Good morning. This is Dr. Sujata Kar, a practicing gynecologist in Bhubaneswar. So, if you are a couple who's been planning pregnancy now or in the near future, take a step back and learn what the gynecologists of various societies are telling us. So, COVID-19 is a virus which is pretty new and we do not understand its impact on fertility, both male and female. We don't know its impact on pregnancy outcome, or on the child that is born as a result during these times. We know that in the past, viral outbreaks like Zika virus, rubella, German measles, etc. have had serious abnormalities in the fetus, congenital abnormalities in the fetus. So if you are planning to get pregnant during these uncertain times, our advice to you would be, first consult your gynecologist or your healthcare provider, maybe do some basic evaluation, some tests, but the primary aim would be to at least find out if it is okay for you as a couple to delay pregnancy by a couple of months. Then other than that, start the regular like folic acid supplementation, learn good lifestyle habits, etc. etc. However, if you have any comorbidities like diabetes, lung disease, heart disease, or mental health issues, please do not plan to get pregnant around this time. Secondly, if you are a couple who is going through fertility treatment to get pregnant, for example, ovulation induction, taking fertility drugs, intrauterine insemination, IVF, which is test tube treatment, or frozen embryo transfers, there are some very important recommendations from international gynecological bodies. First, if you have not started a cycle, it is better that all treatment cycles for getting pregnant should be suspended at this time. If you have already started a IVF cycle or a IUI cycle, then you must go through it. However, in case of IVF cycle, after the egg collection and embryo formation, the embryos are to be frozen for embryo transfer at a later stage. Of course, we do not know when we are safe again to advise you embryo transfer, but for now, you should freeze all embryos and plan a cycle a little later. Suspend all non-essential fertility enhancing surgical procedures, whether diagnostic or operative. If you are diagnosed with COVID-19 around when you are going through a cycle, you must inform your doctor immediately. During every visit to your healthcare provider, you must give voluntarily all accurate history of travel or likely exposure to any COVID suspect. That's very important. Maybe you've been at home during your cycle and you've had a visitor or relative or somebody from outside. You must give that history accurately to your doctor. Take care of your mental health, which is always very important, which means exercise, meditation, yoga, whatever works for you. And as far as possible, for the consultations which is possible to do through teleconferencing, video conferencing, you and your doctor both must try and adjust and take that step forward together. The only exception that may be made for going through a fertility cycle would be newly diagnosed cancer patients in whom fertility preservation is an option. So that category is the only category of patients whom I may, as a fertility doctor, take up for a IVF cycle at this time. So to summarize, I think it would be fair to say that you as a couple should hold your plans to get pregnant till the pandemic runs out. Thank you very much.